Hi, Dr. Ross.
Good afternoon.
You are the founder of the Body Best Doctor Method here in San Juan Capistrano. I have a question. Can you explain us what is the ultrasound machine and in what case do you use it for patient treatment?
Yes, there's two different types of ultrasound. Most people are familiar with imaging ultrasound that came into vogue in 1985. This is treating ultrasound, and it was developed in the late 30s, early 40s. And I'll tell you exactly how it works. Well, first we'll go on when we use it. So people come in and they get balanced here at the Ross Wellness Center, and we actually have scales that show when they're balanced and when they're not, and they don't leave until they're within 5 pounds and they're feeling better. But then they say, I feel better, but my neck or my lower back or my shoulder or my knee still feels a little bit sore. So then I do an examination and we determine that it's lost some of its motion and the joint has developed calcium. Calcium is our main mineral in our body. And so when the body becomes stressed, the bones send out a little negative electricity and attract the calcium into the joint, which is good temporarily, but over time, then we get osteoarthritis with too much calcium. Now we could have big problems, except we use ultrasound. So ultrasound has a wand. It has crystals inside this head, and if I hold it in one place for more than 3 seconds, the patient starts screaming, and this is no toy. So we keep it moving, and we use a gel to have it move nice and smooth on the skin. So if we do a knee or a neck or a back, it depends on the neck would be 3 minutes of ultrasound. Lower back being a bigger bone, it's going to be 5 minutes, and the knees 5 minutes. We rub it right into the joint. Patients just feel a nice warm feeling, very comfortable. Then when I'm done, it makes a little beep on the machine. I said, okay, let me wipe off the excess gel, and I want you to walk around, test your neck, test your knee. They stand up, and then they almost are stunned. They stop. Oh my gosh, Dr. Ross, the pain is gone. I says, that's what it's supposed to do. Congratulations. So that's what we use to get people out of chronic pain, the corrective adjustment, and then the ultrasound. Those two therapies work fantastic. People are excited, and they tell everybody that this is the place to get fixed.
Thank you, Dr. Ross. How often do you recommend ultrasound?
I tell people if they get the ultrasound, I said, let's see you in a day or two, or maybe in a week, see how you're feeling, and then we retest it again. Patient comes in, I says, how's that knee, how's that neck, how's the back? And they say, it went really good for a while, but now, after 3 or 4 days, it started to get stiff again. So then I recheck them, rebalance them, and then we usually do another ultrasound. And I say that whenever it starts to get tender or sensitive, it's not going to get better. Pills and potions are just going to deaden the pain, and they're not going to fix it. I says, come back in so we can recheck you and do another ultrasound. I've never really done more than 5 as far as on a series of injuries on patients. It works so fast and so good.
Thank you, Dr. Ross, for all the information regarding the ultrasound machine.
Thank you.